Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're just joining me right now, as I said before, I'm Aspie, and if you're new, I welcome you all to my channel. I'm all about creating mental health and awareness and sharing my life stories with Asperger's syndrome, OCD and the like, along with tips and advice along the way, be it your general health versus your mental health. I also, along the way, do some fun and games that you may be likely to, want to have a look at as well. So as it's been brought to my attention, as said before, that I'm trying to do as much as I can for these altogether autism conference kind of topics that I have clearly tried to, wait upon for some people's, communication methods. If I can borrow some of their notes or just read off their notes and actually add in my bits and uptake of what I know or understand from what they've shared, so to speak, even if I wasn't highly there, So if you're into any of these videos that I'm sharing with you, albeit mental health versus some fun and games and everything else in between, smash the like button or feel free to subscribe to me as part of a journey with me as a YouTube family member, so that we can get to know each other, and hopefully within getting to know each other we can learn from each other as well, because I'm here to educate, mentor, advocate, and also raise awareness on these topics that I'm clearly addressing, regardless what they are in this point of time. Also, as a brief note, also as a disclaimer as always, before I begin these autism and substance abuse series that are gonna, like I said, gonna be broken down to more little parts here and there. I'm no medical doctor, I'm just your normal everyday Joe Blog, so basically sharing my life stories based on my life experiences or my knowledge and know-how, as well as some of the training that I have come about. So if you see any of the warning signs or symptoms based on some of the past or previous videos I've shared of any given topic, seek professional help for yourself or your loved one, or even professional advice for yourself or your loved one, because I don't forever condone self-harm. So now, as I said before, these ones are all about autism and addiction series and whatnot. So this one's a question that we need to ask ourselves: is there a link between autism and addiction? As you are aware or not aware, however, about this topic that I'm sharing with you, autism is a mental health condition, even though many people label autism as many other kind of, condition, be it mental health, be it, neurological and everything else. But I'll clearly suggest that somewhere along the way I did share something about this, about what it is, so that you can gain a better understanding. If you want to watch that, I suggest to stop this video and refer back to that as well, and I will link it hopefully in the description below for you guys. But as it is, though, autism is a mental condition that is a broad spectrum disorder. This is mainly characterized by difficulty communicating, forming relationships, be it, friends, family, teachers, co-workers and the like. Also, and also they have difficulties in or forming, forming of a way of articulating abstract ideas. Autism may also be accompanied by sensory processing issues such as discomfort in loud, busy places, or wearing certain types of fabric. Obviously, some of us autistics may have some form of sensory regulations of how we're sensitive to touch, smell, taste, and all these other 5 classic senses that you guys obviously think we take for granted. These sensory issues may also be extended out by touch of others, as I shared, and the types of foods that one can tolerate while the other one can't tolerate while eating. This is often referred to as a term of Autism Spectrum Disorder, and so many other things as well that comes with this. In the past, an autism diagnosis was often safe for those on the lower functioning end of the spectrum. However, these people may be nonverbal, among many other symptoms, but again, I clearly can't stress it enough that many autistics will be different. Some will be nonverbal, some will be verbal, depending on how they are brought about. It was thought that those with a diagnosis with autism weren't susceptible to alcohol or drug addiction due to the disorder that they have. That was due to their rigid routine structure, however, and also within that rigid structure of routine also comes along isolation from their typically developing peers. Since there has been a rise in high functioning autism diagnosis in recent years, though, however, there are some changes to this perception or idea of what autism is all about, however, as well as just, autism and addiction in general. People with high functioning autism can have a typical or high IQ level. They can communicate, although perhaps some difficulty in terms of social behavioural norms. They can also live independently and may have peers that are typically functioning. This may also mean they have access to drugs and alcohol. According to the article from an article called The Atlantic, however, for much of the 20th century, most of those who received an autism diagnosis were on the severe end of the spectrum. In this largely nonverbal population, however, addiction has been seen more than unlikely. But in the year of 1994, when the Diagnostic and Statistical Manual of Mental Disorders added Asperger's syndrome as a category, the spectrum extended to people who had much more opportunity to access alcohol and other drugs. Still, for years, assumption remained that addiction was one of the main concerns the autism community could safely ignore. Studies point to a link between addiction and autism is the next part of the section. As I said before, in a recent study in Sweden, however, the study has shown an increased risk in substance abuse issues in those with autism spectrum disorders. Yet substance use related problems have been among 19 to 30% of patients with ASD, at least in the clinical settings of what they've found in their research. It has been suggested that the high rates of substance use related problems may be attributed to comorbidity between ASD and ADHD. Indeed, both ADHD and intellectual disability frequently co-occur with ASD and are linked to substance use related problems, since psychiatric disorders comorbidity is more likely to be noted in the highly selected clinical populations. The setting might considerably influence rates of concurrent documented substance use related problems. Some of these connections does have to do with co-occurring disorders as well as the genetics that plays a role. The study concluded in summary, this large population-based study suggests that individuals with ASD have higher risk of substance use related problems than population controls, most likely because of shared familial liability for these conditions. An important implication of our findings concerns diagnostics and treatment strategies in ASD. Increased risk of substance related problems, however, in ASD suggests attention and preventative measures regarding substance use disorder in this population group. Since ASD has been frequently co-occurring with ADHD and other intellectual disability, and the trajectories of ASD into substance abuse may differ depending on the concomitant conditions. The present results also highlights the need for comprehensive psychiatric examination upon deciding which treatment strategies for substance use disorder will be beneficial. One study from 2013 states subjects with Asperger's syndrome did score higher on the introversive, inhibited, doleful, and borderline tendency prototypes than healthy controls, and scored lower on all sensation-seeking traits. Being male, a diagnosis of Asperger's syndrome, introvert, and unruly, introversive, and sensation-seeking treatments were all independently associated with the risk of drug abuse. It looks like autism may be added to what is commonly known as co-occurring disorder with substance abuse. So you may be asking me, what are the symptoms of high-functioning autism or Asperger's, which obviously, as I said before, I don't like using that term, but we'll call it Asperger's or what have you, or autism. Even though high-functioning autism can be hard to diagnose, this is one of the many reasons substance abuse in this population can be difficult to treat and manage. Here are some common symptoms of high-functioning autism for you all to know about if you haven't known already. 1. They become easily overwhelmed with excessive verbal direction, calmed by external stimulation, e.g. soothing sounds or fidgeting, difficulty with loud or sudden sounds. 4 is emotions can pass very suddenly or are drawn out for an extended period of time. Intolerance to certain foods, textures, colours, or the way they are presented on the plate, e.g. one food can't touch one another. May need to be left alone to release the tension and frustration that they may feel. Resist to change in the environment, people, places, and anything that's familiar to them. Sensitivity or lack of sensory sounds, textures, taste, smells, or light. Unusually high or low pain tolerance. Aversion to answering questions about themselves. Difficulty maintaining some friendships and keeping to them, trouble reading facial expressions and body language, understanding group interactions and understanding the rules of conversation. They'll have a tough time understanding jokes, basically figures of speech or sarcasm. Difficulty sharing observations or experience with others, makes honest but inappropriate observations, minimal acknowledgement of others, overly trusting or unable to read people's motivations. prefers to be alone, aloof or over-friendly, resistance to being touched, responds to social interactions but may not initiate them, seems to be unable to understand other people's feelings, talks excessively about one or two topics that they enjoy or know of, basically. Tends to get too close when speaking to someone, i.e. maybe a lack of personal space, unaware of or disinterested in what's going on around them, difficulty in making eye contact. For adults who has misdiagnosis as children, the National Autistic Society states that the characteristics of autism will vary from person to person, however, as I clearly addressed so many times. But in order for a diagnosis to be made, however, a person will usually be assessed to having had a persistent level of difficulties with facial communication and social interaction in their peers, along with restrictive and repetitive patterns of behaviours, activities or interests. This includes the sensory behaviour since the early childhood, to the extent that these limit and impair their everyday functioning. Co-occurring disorders and the connection to substance abuse. According to the National Alliance for Mental Illness, about a third of the people experiencing mental illnesses and about half of people living with severe mental illnesses also may experience substance abuse. These statistics, however, are mirrored in the substance abuse community, where about a third of alcohol abusers and more than half of all drug abusers report experiencing a mental illness. Men are more likely to develop a co-occurring disorder than women, though, however. The risk is even higher if the individual is from a lower socio-economic status, is a military veteran, or is someone with another general medical illness. Mental illness and addiction coexisting doesn't mean that one necessarily causes the other. The causality is unclear for many reasons, though. First and foremost, though, drug addiction can cause you to experience one or many of symptoms of a mental illness. Second, mental illness can trigger along the drug abuse as a way of self-medicating, and the third reason maybe is other factors such as genetics, and a history of trauma can cause a dual diagnosis. Common co-occurring disorders include the following: anxiety, ADHD, bipolar disorder, depression, eating disorders, obsessive-compulsive disorders, post-traumatic stress disorders, trauma in itself. The need to self-medicate is common in co-occurring disorders. Okay, you're going to growl at me, guys, if you're watching, for some of the ones that are maybe autistic or not, but I humbly apologise, but it's what I found in one of my findings based on the Autism Speaks. I know you guys don't like to hear about this, but that's just life, you know. It's based on what I've found. I know that some of you guys may not agree to some of this, but I'll just read this anyways, you know, what they've said. Compared with classic autism, children with Asperger's syndrome, high-functioning autism, or HFA, have IQs that fall in the normal or even superior range. They may just seem like any other children, but not quite. Children with AS are socially awkward in a manner of speaking that is really easily misunderstood, or not even easily understood by others. This will explain why healthcare providers may miss seeing Asperger's syndrome or HFA symptoms in their young patients, or may even misdiagnose it completely, as I said before, due to, you know, other regular symptom like comorbid disorders that comes into play with it. The late onset of complex social skills such as peer interaction, communication and the like also explains why some parents don't seek help until much later compared to those whose kids display a more profound or more obvious set of symptoms from a very young age. To fit in with their peers, they may feel tempted to use substances to hide their social anxiety or fear under the guise or high of the drug. Their autism symptoms may even go unnoticed by friends, schoolmates and the like. The challenge of treating co-occurring disorders. As we know, basically, addiction removes the structure from someone with autism that often needs it most. Drinking or using drugs may relieve anxiety or sensory overload for the short term, but if the cycle of addiction begins, it's difficult to overcome, like many other people off the spectrum as well here. There are many options for those with dual diagnosis to overcome their substance abuse, and they are as follows. CBT, which is your cognitive behavioural therapy, which focuses on decreasing dysfunctional actions and thoughts. This is an effective approach for those with disorders such as depression and anxiety. The goal is to break the cycle of any negative thoughts while transforming them into some positive thoughts. It also tries to find an effective way for stress coping mechanisms other than just the substance abuse that people tend to do. CBT works to address immediate problems in the short term. CBT can be done while in detox or in addition to many other types of therapy that I'm clearly addressing right now. Group therapy. Group therapy can be specifically targeted for people who suffer from a variety of dual diagnoses. Again, members are educated on the types of diagnosis, however. Groups are encouraged to work and think together to motivate and provide support. Everyone in the group benefits from the relationships they develop, as well as the sense of self-worth and optimism that comes from working through a common challenge. Medications. Although abusing substances isn't always safe, treating a dual diagnosis with a physician-prescribed medication can be. For mood disorders, though, however, there can be medications such as antidepressants, anxiolytics, and antipsychotics. Other prescribed drugs for co-occurring disorders are selective serotonin reuptake inhibitors, or SSRIs. These are drugs such as Prozac, Celexa, and Zoloft that can regulate chemical imbalances by increasing the hormone serotonin in the brain. They are used to treat mood disorders because of their mild side effects compared to other medications. Another one is individual psychotherapy. Psychotherapy is also known as individual therapy or counseling, however. This is when a therapist and patient will work together to make changes to improve their quality of life. This is a safe place for doctors and patients to discuss private matters and impediments during their recovery process. The topics are not limited to addiction or the dual diagnosis. Therapists will also work with patients on things like self-esteem, empathy, and happiness, so that the overall well-being of the patient is clearly addressed. A good therapist will help someone with autism to create specific goals for your recovery, overall health, and co-occurring conditions. Treatment that addresses those with high-functioning autism doesn't exist, though, however, or does exist, I should say, and it's often treated very similarly to anyone with a dual diagnosis. The important thing to note here is, before I end this, is that recovery from substance abuse for those with autism diagnosis are clearly available. It's just a matter of looking and seeking the right help included. Well, this ends briefly about is there a link between autism and addiction. Give me a like for thumbs up for support. Comment below if you feel the need to share your experiences with this as well, and maybe share your thoughts if you believe there is a link between autism and addiction. As a challenge for you guys, maybe to open that floorboard of discussion. And all for the day, guys, basically, if you haven't done so already and you would like to be part of the YouTube family, feel free to subscribe, and if you haven't done so already, turn on the notification bell while you're down there. Feel free to share these videos around to family and friends. Don't forget to follow me on my social media sites if need be, or even private message me on my AspieAnswersAll, and I'll do my utmost best to communicate to you guys if you've got a problem, or you just feel like you want me to read some of the stuff that you're sharing with me, and maybe my personal uptake of what's been shared, regardless if you don't want to, open it up to the floorboard of discussion on any related topics that are clearly addressed right now. So for the day, guys, thanks for support, thanks for watching, do what you love what you do. Until next time, Aspie signing out, and I'll see you again soon. Ciao for now.